We're going to look at the two types of change and how learning organizations can move ahead with changes that benefit nurses and patients alike. The idea for change takes on a new intensity and it requires considerable work. So at the end of the discussion of this lecture, you will be able to evaluate the use of select functions, principles, and strategies for initiating and managing change, and apply quality management principles to clinical situations. There are two types of change. There is planned change, or linear change, which is a slow methodological approach that is viewed as linear. Planned change typically deals with predictable changes such as determining how to educate all staff on the use of a new piece of equipment. Nonlinear refers more to a web. In other words, everything is connected. Pulling on one piece moves other pieces towards that a new pattern appears. Most change in healthcare is complex because it involves many people and clinical and organizational changes. A common way to view planned change is to use Lewin's force field analysis. This analysis allows us to look at all elements in a situation to determine what barriers we must overcome and how quickly a change can occur. Barriers and facilitators can refer to the elements of the change, such as gaining information, securing funding, and having needed equipment, including technology. They can also refer to people or groups of people. In other words, we can use this approach to map by name who is against and who is for a change, or which groups of people, either internally or externally, will support the proposed change. Although each situation has to be analyzed, some common barriers exist for almost every change. The first is budget. If the change doesn't save money, at least in the long run, it will be difficult to secure support from the administrators who have key accountability for costs. Even the planning sessions have money associated with them because the people in those sessions are not providing care or performing normal work. Equipment may merely be focused on accessibility, but it also may involve purchases. If the equipment has a high degree of unreliability that then consumes important staff time, the chances of a change being adopted are diminished. On the other hand, if the equipment can save time and increase safety and reliability, it is not a barrier. People who value the status quo and are fairly averse to change are typically barriers to change. To convert them to being at least neutral takes effort on the part of group leaders. Often people who prefer the status quo see no benefit to themselves to take on the proposed change. How that insight is developed is a challenge for leaders and managers. Finally, groups who see the change as a threat are not supportive, and if their numbers are sufficient, they become a very powerful opponent. Sometimes the reason a group opposes a change is because they see the change as eroding their turf and power. These are difficult challenges to take on. Other times they oppose change because it has not been described adequately, especially in terms of patient care benefits. For example, when healthcare took on the added task of specifically identifying the limb to be amputated, some groups thought this was an unnecessary task. However, the publicity surrounding mistakes is very compelling. Common facilitators include many elements. The most basic facilitator is data, but it alone doesn't convince all that change is needed. A second facilitator exists when there is community support. For example, during a hospital expansion project, the surrounding areas are often disadvantaged. But if that community sees there will be fewer traffic issues and better access, they are often engaged in supporting the change. One of the key elements of facilitation exists when there is buy-in by physicians and nurses. These two groups are key to big changes that occur within a healthcare organization. Most importantly, however, is the driver for any change, patient safety. If the benefit to the patient is clear, it is easier to obtain buy-in from important groups, including physicians, nurses, and the community. The second type of change is nonlinear or complex change. Think back to the figure of this change. The interchange between what is happening within the organization with what is happening external to the organization shapes both changes. For example, think back to the example I gave about the hospital expansion program. I said the community had bought into the change because they saw the end result. Now think what would happen if there was some major delay or an explosion occurred on the site and there was publicity about the way in which the building expansion was being funded. Suddenly the community isn't so supportive. Now the organizational representatives are spending more of their time managing the external relationship than they are moving the project itself ahead. The Institute for Healthcare Improvement, the group that has addressed saving 100,000 lives per year through better safety measures, also has worked on a project called Transforming Care at the Bedside. Think of this as a small change projects that are based on nonlinear change. This work is designed to support direct care nursing staff in making instant change when they see better ways to provide care. So this work is designed to support direct care nursing staff in making instant change when they see better ways to provide care on medical surgical units. Rather than following the traditional planned change approach where an idea circulates through numerous committees, the policies and procedure are carefully worded and the supporting data have been pooled. This initiative allows the translation of research and changes in systems to occur almost instantly so that patients benefit immediately from ideas that suggest care is provided in a better way. The spread effect, meaning the translation of the new way throughout the organization, occurs through the traditional committee. The change then is one where the committee is formalizing in the existing practice. Peter Seng says there are 5 disciplines that an organization must engage in to be a true learning experience. The 5 critical disciplines we must engage in throughout an organization are these. First is systems thinking. Each of us must think of an organization as a living entity and know that one of us does affect the organization. The organization has a set of values that are lived out and support personal mastery. 2 is personal mastery. Systems are in place that help all of us learn so that we are well informed in order to provide patient care patients seek. Third are the mental models. Each of us operates on certain values, beliefs, and assumptions. For example, I assume my car will start in the morning so I can get to work. Organizations have similar assumptions, for example, that people want to do their best, that employees value patients and the work that they do on their behalf. These are mental models. Fourth is a shared vision. When the mental models of assumptions, values, and beliefs are examined and common ground is established, we have created a shared understanding. Moving back to the future in a unified manner is the way in which shared visions are established. This shared vision is designed to make the organization a better place to work, a better place to seek care, and a better corporate citizen of the community. Finally, the third discipline is team learning. This refers to a cohesive group sharing learning experience so that each individual benefits the other. This exchange results in more dramatic outcomes. Change agents and followers, irrespective of the role an individual holds in an organization, each person is either leading a change or supporting a change or being an obstructionist. It may be useful to be an obstructionist if you cannot see change as beneficial. Once you are clear, however, that the change is positive, you are either the agent or the follower, and those two roles may be fluid. For example, when the nurse manager is present, you may be the follower. When you are working with a preceptee, you may be an agent. Change requires a group of people working together to be effective.